Hello everyone, my name is Atif Rahman. Today I want to talk about a medical emergency such as cardiac arrest. What is cardiac arrest? What are the symptoms of cardiac arrest? What are the signs of a cardiac arrest? Let's talk about what is a cardiac arrest. A cardiac arrest is a sudden and severe failure of the heart that stops pumping blood to the vital organs such as the brain and the lungs. The heart has its own electrical system that controls its rhythm with a natural pacemaker built in. If something disrupts the normal electrical impulses, like a blockage or an irregular heartbeat or a damage to the heart tissue, the heart may cause problem pumping blood to the vital organs, leading to a catastrophic situation like the cardiac arrest. What are the signs and symptoms of a cardiac arrest? When a person is going through a cardiac arrest, they might turn pale because of the lack of flow of oxygen to the brain. They might faint due to the lack of flow of oxygen. We might experience the person going through abnormal breathing, suffocating, or gagging. There are some first aid procedures and protocols for a crew member or a staff to proceed with safety measures in such emergency situations like cardiac arrest when we are in a flight or in ground. When someone experiences cardiac arrest, the immediate response is to prevent death or further brain damage. Let's talk about the safety protocols a crew needs to follow during such an emergency. We should always assess the situation in an emergency situation like this. We should always make sure the patient is safe around the passengers and the passengers are safe around the patient to proceed with the safety protocols. We should always check for vitals and check for responses from the victim or the person going through the cardiac arrest. We should call for help. That means we should let our in charge and the pilot or the captain know about the situation on board. We should always reach out to MedLink as they are the medical support team to assist us during such medical emergencies. We should always monitor the vitals and conduct a head-to-toe examination of the person going through a cardiac arrest. We can use emergency equipment available to assist us during such emergencies. The emergency equipments available on board are oxygen cylinders, the emergency medical kit, or the AED, which can all be used in an emergency situation like this. So, what is a medical emergency kit? A medical emergency kit includes medications such as IV fluids and other medical tools. It is typically used by a medical professional or a crew member is permitted to use it in such emergencies. One more thing, during such emergencies, we can always ask for help from a nearby first aid, nearby doctor or a medical professional present among us. If the person is not breathing or gasping, or there is no pulse, we should always proceed with a CPR and constantly check for the breathing and pulse. We can use an AED in such situations. We should turn the AED on, attach the pads to the patient's chest, and if a shock is mandatory or required, we can go forward, but we have to make sure that nobody is touching the patient before delivering a shock. Continue the CPR if no shock is advised, or after the shock until the medical help arrives. By following these safety procedures and protocols, we can always save a life, as safety is our first priority.